Okay, this is a video for the ovaries and what happened within the ovaries. As you see here, this is the ovary, and this is the ligament, or the fallopian tubes will come from here, and this is attachment of the ovaries. If you look within the ovaries, you will see primordial follicles, these little follicles right here, and then the primordial follicles will change to become primary follicle, and then the primary follicle will become larger and start to have some cavities a little bit, will become the secondary follicle, and then these cavities will join together to make a larger cavity, and now we call it the tertiary. So primordial is the little ones, primary, larger, secondary, you start to see cavities, tertiary, when the cavities come together and make a larger cavity within here, and this is larger, and then the tertiary follicles are going to release the secondary oocyte, and the secondary oocyte will be surrounded by corona radiata, which are these radiations right here. So this is a secondary oocyte that's been released out of these tertiary follicles. This part, the remaining part after releasing the secondary oocyte, will become the corpus luteum, and the corpus means body, luteum means yellow, so this is the yellow body. And the yellow body, if there is a pregnancy at this point, it will stay and it will produce progesterone, the hormone progesterone, and the female hormones. And if there is no conception happen, it will start to shrink and become white in color, which is the corpus albicans, and the corpus albicans will disappear. If you apply that to this model right here, these are the primordial follicles, these tiny follicles here, like these are the primordial follicles, which is number 10. Look at it this way. So this is the primordial follicles, number 10, and then the primordial follicles will start to grow up, making the primary, which is 11, secondary, you start to see some cavities, that's the secondary follicles, and then the tertiary follicles right here, and then from the tertiary follicles, the ova, or the secondary oocyte, will be released, and the remaining part, which is this part here, will change to become a yellow structure, and this will become this, which is the corpus luteum. Corpus means body and luteum means yellow, so this is the yellow body, corpus luteum. If pregnancy occur or conception occur, it will stay to secrete female hormones. If not, it will change to the white body, which is the corpus albicans. Obviously albicans means white. And here it is, this is what I was talking about here, which is the tertiary after ejecting this, which is the secondary oocyte that's surrounded by corona radiata. So the tertiary eject secondary oocyte surrounded by corona radiata, and this, the remaining part, will change to become the corpus luteum, which will change, if no conception occur, it will become the corpus albicans.